for having me. I'm a policy researcher. I've been working on childcare policy for about 40 years, and I asked to speak today to challenge the contention that the city can achieve greater value by divesting these 52 centers of this recommendation. I think the main point that I want to make is that the idea that greater value in childcare equals cheaper in a traditional audit sense, based on what we know about quality and funding, is quite questionable. And I further believe that the rationales provided for the recommendation are not grounded on a thorough enough understanding of the complexities of childcare policy and services to stand up to scrutiny. I just want to start by noting, of course, that this isn't new. Schemes to close publicly operated childcare have been around in Ontario for as long as I can remember. In the past 5 or 6 years, there have been repeated divestment proposals across Ontario. Each time, the same rationales, the same rebuttals from the childcare community and from researchers and parents have actually been put forward. In most cases, consulting firms were hired to study the issue. In most cases, public protests opposed the divestments. Some of these successfully, some not. Windsor, Peel, Sarnia, and others closed their centers. Waterloo, Peterborough, Durham, Thunder Bay, and others did not. Back before the 2012 budget, Toronto proposed closing municipal childcare as was on the table as part of the sweeping budget cuts. It was panned during the public protests against the austerity measures and didn't move ahead. After that, a contract to study children's services was awarded to Deloitte, who engaged me as their childcare consultant on this same topic. And I'm mentioning this because the same issues as the present report covers were hashed over at that time. The arguments made to consider divestment weren't convincing enough to be acted upon back in 2013. I just want to single out 3 aspects of the report that I think should give cause for concern. First of all, I'm really surprised at the way quality is argued. It's based on compliance with licensing requirements. Based on this, the report argues that city centers are only marginally better quality than other centers. The problem with this is that compliance with licensing isn't considered by anybody to be a measure of quality. Meeting licensing requirements is considered only to be a minimally acceptable standard below which children might be harmed. There is research by Cleveland, which is mentioned in the report on quality assessments, that did find that city centers were significantly higher quality than other centers. The report dismisses this study, asserting that provincial surveillance has improved since the study was done in 2009. But to the contrary, the 2014 provincial Auditor General's report included a whole chapter outlining multiple concerns about inadequate provincial surveillance and the effects on children's health and safety. And I just want to emphasize that high quality in childcare is not a small point, but it's key, especially for the vulnerable and lower income children who make up the bulk of the population in these centers. A second area of concern that I have is how the report addresses childcare staff wages. The reason that alternatives are being proposed is because city center costs are higher, with higher staff wages being the main cause, not the only cause, but the main cause. But the report seems to be saying, what, the city wages are too high, or they're not providing sufficient value. It does not mention that municipal childcare wages are the comparator for the proxy method of determining pay equity under the province's Pay Equity Act. It also doesn't mention the clearly established connection between childcare wages and staff recruitment and retention, an issue that plagues the childcare field. City centers and other high-wage centers find it easier to recruit and retain qualified staff. And this is a factor that affects not only quality, it affects vacancies, and it affects the possibility of expansion in the nonprofit sector. So to that point, my third point of concern is the report's assumption that the spaces in the city center, which as we know are disproportionately serving infants, toddlers, special needs children, newcomers, low-income families, can easily be transferred to nonprofit centers. I don't think there was consultation, much or any, about the many issues involved in making this assumption. But I think that whether nonprofit operators are ready, willing, and able to take up the challenge of expansion, given all the other challenge that they're facing, I think that's quite a questionable assumption.
Wrap up, please.
Okay. I think the point I want to make is that there are a lot of issues of concern in this report, and the idea that in childcare, value for money doesn't necessarily mean cheaper. Therefore, with all this in mind, I join my colleagues in urging the committee members not to pursue, once again, hashing over the alternatives to delivering childcare through these centers. Thank you.
Thank you.